Bones are living tissues in our body. Bone tissue is dynamic and undergoes a continuous process of renewal through three types of cells: osteoclasts, osteoblasts, and osteocytes. Bone tissue is broken down and reabsorbed by osteoclasts, and new bone is formed by osteoblasts. The blood vessels within the bone facilitate the supply of oxygen and nutrients to the osteocytes and keeps the bone nourished and healthy. Avascular necrosis, or AVN, is the death of bone tissue that results from interruption of blood supply to the bone. AVN occurs due to alcohol abuse, intake of corticosteroids, and trauma. One of the largest weight-bearing joints in the body, the hip joint, is the most affected joint due to AVN. In a patient with AVN caused due to high-dose steroids, fats and lipids obstruct the blood supply to the bone. Without blood supply, osteoclasts and osteoblasts cannot function and bone tissue starts to die away. As more bone tissue decays, the hip joint is unable to function. Pain starts in the hip, and it radiates to the groin and knee. The mobility of the affected joint is lost, and the patient develops a limp. Daily activities become painful, and even bending the hip to tie a shoelace is excruciatingly painful. The hip joint eventually breaks down or collapses, and a patient becomes disabled due to joint immobility within 2 years if left untreated. Oscro bone cell therapy consists of using the patient's own cells as a therapeutic tool to treat AVN. The therapy involves implantation of bone cells called osteoblasts that are delivered inside the patient's hip joint through a minimally invasive procedure. Implanted osteoblasts synthesize collagen and produce hydroxylapatite to form a strong and dense mineralized bone tissue matrix. This newly formed bone tissue supports the hip joint, leading to joint preservation and thus preventing further disease progression. Oscro is a commercially approved cell therapy, licensed by Indian FDA DCGI. Recent medical publications highlight the excellent safety and long-term effectiveness of Oscro for patients suffering with AVN. After undergoing Oscro treatment, patients are able to live a pain-free life, prevent hip surgery, and return to sports.